It was a cold day and he was walking outside and a single snowflake landed on his cheek, which resulted in a huge onset of a trigeminal neuralgia attack, and he literally had to hold himself to a lamppost for 20 minutes before he could walk again. So this is a very graphic representation of what an attack of trigeminal neuralgia is like. Trigeminal neuralgia is a very severe form of neuropathic pain generated from nerves themselves that affects typically only one side of the face.
We don't know what it means to have pain versus not having pain, other than having subjective reports from the people who experience pain. We wanted to change the paradigm in this evaluation and propose something which can be explicitly measured in the human brain and potentially used as an instrumental tool for the prognosis of the outcome and the accurate diagnosis.
We started with advanced forms of brain images that we acquire for patients to see what would be the key signatures that define pain. A key challenge that we came to was the observation that conventional methods of statistical analysis were not sufficient, used information that was not homogeneous. And we then went on to rely on machine learning and artificial intelligence.
Essentially, AI for us is the same as, for example, microscope for the histologist or telescope for the astronomy. It's allowing us to discover and identify those hidden patterns, hidden measurements, which help us to predict successful surgical response before the surgery is being done.
We initially observed that patients that have severe form of pain, such as trigeminal neuralgia, when we look at their chronological age and match that to their brain-derived age, there's a significant mismatch, meaning that their brains have aged directly related to their experience of pain. We use also other forms of pain to compare, and what we found is that in fact it's different for different types of pain. And in proportion, females exhibited accelerated brain aging much more than males.
This study creates an important foundation for multiple different research projects we're currently doing in our laboratory, focused on predicting the treatment response for trigeminal neuralgia surgery using the brain imaging data even before performing the surgery. Other parts are focused on trying to predict pain states from non-pain states using brain imaging data alone. And a part of the work is also focused on additional tools for the image acquisition and helping to avoid the necessity to repeat MR imaging scans for multiple times for the patient, which would help to shorten the times for evaluation, assessments, and potentially help to improve the clinical outcome for those patients.